Good evening, ladies and gentlemen, and welcome. I'm Mary Pouton, Assistant Dean for Development here at the University of Maryland School of Medicine. Thank you for joining us virtually for our 14th annual Celebrating Diversity event. It is my honor tonight to thank all of our sponsors who have supported our celebration. First, thank you to our presenting sponsors, the Medical Alumni Association of the University of Maryland School of Medicine and the University of Maryland Medical System. I'd like to thank our gold sponsors, Express Care, Urgent Care Centers, and the Whiting Turner Contracting Company. Thank you to our silver sponsor, the Banks Contracting Company. I would like to recognize our partner sponsors, the Departments of Anesthesiology, Epidemiology and Public Health, Family and Community Medicine, Obstetrics, Gynecology and Reproductive Sciences, Pathology and Medical and Research Technology, the Departments of Pediatrics, Psychiatry and Radiation Oncology, also the University of Maryland Marlene and Stuart Greenbaum Comprehensive Cancer Center, and Shock Trauma Associates Program in Trauma. Thank you all. I want to also thank those who have contributed directly to Dean Emeritus Donald W. Wilson Endowed Scholarship Fund. Many others have also made personal contributions to establish new diversity scholarships or supporting existing funds, all helping us to increase the resources available for scholarship support for the School of Medicine. We truly appreciate everyone's support of this event and the entire scholarship program at the school. At this time, I'd like to introduce our honorary chair for the evening, Dr. Maria Soto-Green. Dr. Soto-Green is professor and executive vice dean at Rutgers, New Jersey Medical School. In her current role, she oversees all aspects of undergraduate medical education, faculty affairs, professional development, accreditation, and diversity affairs. Dr. Soto-Green is committed to advancing the school's health equity and social justice education and community service. She has been funded by federal and private agencies since the early 1990s and has passionately worked to create unparalleled opportunities for thousands of individuals underrepresented in medicine and in science. Dr. Soto-Green has been the recipient of numerous awards recognizing her contributions to advancing diversity in academic medicine. Most notably, the AAMC awarded Dr. Soto-Green with the 2019 Herbert W. Nickens Award for her contributions to promoting social justice in medical education and health equities. We are delighted to have Dr. Soto-Green as this evening's honorary chair.
Good evening, ladies and gentlemen. Thank you for joining us and welcome to the 14th annual Celebrating Diversity event hosted by the University of Maryland School of Medicine. I am honored to serve as the chair of this wonderful event, and I look forward to enjoying this evening's outstanding program with you. This year, as in previous years, proceeds from this event will be used to support the Dean Emeritus Donald E. Wilson Endowed Scholarship Fund. Scholarships are key to ensure many talented students, especially those from lower socioeconomic and disadvantaged backgrounds, are given the opportunity to pursue a career in medicine. The organizing committee for the Celebrating Diversity event has put a great deal of time and energy to make this event a success. Dr. Zolta Miles and Charlotte Jones Burton, two alumni who started this effort more than 10 years ago, deserve special recognition for those efforts and for continuing to champion this important initiative. Dr. Jones Burton and Dr. Miles, thank you for help to not only advance this mission, but also your commitment to pay homage to the giant that is Dr. Donald E. Wilson, Dean Emeritus of the University of Maryland School of Medicine. Thank you for a job well done. At this time, I am pleased to introduce the chair of the School of Medicine Board of Visitors, Ms. Cynthia Egan, former president at T. Rowe Price.
Thank you, ladies and gentlemen. It is a pleasure to be here this evening. It has been a privilege to be associated with the School of Medicine for over 7 years, and I'm honored to speak at this event, which benefits the Wilson Endowed Scholarship Fund. Dr. Wilson's career has been a testament to his deep commitment to diversity and inclusion in medical education and the healthcare profession. An endowed scholarship bearing Dr. Wilson's name is a most appropriate tribute and has proven to be an inspiration and an immense honor for the student who received this scholarship. I'm truly proud that the school is constantly seeking opportunities to enhance diversity in ways that will transform the healthcare workforce and address the needs of an increasingly diverse population. I'm proud to be here tonight and to celebrate the School of Medicine's strong and steadfast commitment to its efforts to attract, support, and promote underrepresented minorities throughout the school. At this time, it is my honor to introduce Dr. E. Albert Reese. Dr. Reese is the Executive Vice President for Medical Affairs at the University of Maryland, Baltimore, the John Z. and Akiko K. Bowers Distinguished Professor and Dean of the School of Medicine. Please welcome my friend, Dean E. Albert Reese.
Thank you, Cynthia, and thank you for your kind introduction. I also want to thank you for the dedicated service that you give to the University of Maryland School of Medicine. I'm so grateful for your dynamic and effective leadership of the School of Medicine's Board of Visitors. Thank you so very much. I'd also like to thank Dr. Soda Green for serving as our honorary chair for tonight's celebration. We are delighted to have you serve as our program speaker and moderator. You're truly a champion for diversity and inclusion in medicine and science, in fact. It is an honor for us to have you be part of our celebration this evening. Ladies and gentlemen, good evening and welcome. Thank you for joining us this evening at our 14th annual Celebrating Diversity event. It is wonderful to have such a large group of friends, alumni, guests, faculty, students, and staff who are joining us virtually to celebrate the work of the School of Medicine's community and what it's doing to promote a more diverse healthcare field. Tonight, we also acknowledge and welcome my friend and colleague, Dean Emeritus, Dr. Donald Wilson. As many of you know, Dean Wilson was the Dean of the School of Medicine for 15 years, until 2006, when I began my tenure. I want to thank Dr. Wilson for his leadership over the years and how he has paved the way for many of the successes that we currently enjoy. Thank you, Dr. Wilson. Our institution is currently in the top tier of schools of medicine in the United States, with a rich culture of academic excellence, discoveries, and outstanding clinical care. We're delighted to have played and are playing an important national leadership role in COVID-19 statewide testing, as well as national vaccine development. Throughout the years, we have made great strides to ensure a diverse and inclusive institution at all levels that truly reflect the society in which we live. Before we continue with our program this evening, I'd like to introduce Dr. Kristen Rivas. Dr. Rivas is the Director of Student Diversity and Inclusion. She will give us an update.
Good evening, Dean Reese, Dean Wilson, Dr. Soto Green, invited guests, students, and friends. We are certainly meeting under different circumstances than we did last year, but it is wonderful to know that we've committed ourselves to celebrating our diversity, despite the virtual nature of this year's program. My name is Kristen Rivas, and I am the Director of Student Diversity and Inclusion here at the University of Maryland School of Medicine. In the time since we last joined together, so much has occurred in our nation and university. We have witnessed, and in some cases experienced, the effects of the twin pandemics, COVID and continued systemic injustice, on our personal and professional lives and the lives of those we care about. We have also seen people of color lead the fight against both. We have witnessed one of the darkest days in our government's history, but this was swiftly followed by the inauguration of the nation's first vice president of African and Asian descent. This year has been full of ups and downs, but through it all, we've been able to maintain a glimmer of hope. In our own School of Medicine community, we have taken the opportunity to look within ourselves to confront the historical impacts of racism and sexism in medicine. We have been intentional about making our institution one that integrates elements of inclusion, equity, diversity, and anti-racism into the curriculum. Furthermore, we have developed and adopted a social justice compact that reinforces our commitment to strive for a culture which demonstrates equity and inclusion, regardless of race, ethnicity, age, gender identity, sexual orientation, or any other variable that makes individuals different. To the students, both prospective and enrolled, please know that regardless of what intersection of identities define you, you are supported in our institution. Many of my colleagues share my dedication and passion and want to make sure that you succeed. To my fellow faculty, my charge for you is to join me in support of our students and to ensure that they feel encouraged and inspired during their tenure here at the School of Medicine. Together, we can continue to make the University of Maryland among the best in the country. Once again, thank you and have a great evening.
Thank you, Dr. Rivas. Throughout this year, we set aside a special time to celebrate our ideals and priorities. The School of Medicine recognizes and reinforces the positive impact that takes place in a healthy, robust, and diverse academic environment. Tonight, we reaffirm our commitment to the values of diversity, and we celebrate the successful strides and accomplishments that result from this commitment. The School of Medicine is strongly committed to the recruitment and the retention of talented, ethnically diverse faculty, staff, trainees, and students. Currently, the School of Medicine's faculty body makes up more than 3,000 individuals. And this is comprised of 41% women and 11% underrepresented minority faculty. In addition, 45% of our women faculty make up the School of Medicine leadership team. In addition, the student body is comprised of 61% women and 24% underrepresented minority students. A robust scholarship program is critical to creating and maintaining a diverse, dynamic, and scholarly academic community. For example, during the 2020-2021 academic year, the School of Medicine awarded more than $5 million in direct financial support to our students. Of that total, $2 million were awarded in the form of diversity scholarships to 70 medical students. We're exceedingly proud of this level of investment that we make every year. Thank you and congratulations. We're most grateful for the generosity of our alumni and friends whose gifts have supported these scholarships. Proceeds from this award at this event and the generous contribution from many of this celebration has enabled us to create an endowed scholarship in Dean Wilson's honor. We will continue to expand the Wilson Scholarship with tonight's proceeds. Dean Wilson, we're very pleased to have this scholarship, which honors you and your legacy. In addition, it rewards outstanding and deserving medical students for many years to come. At this time, I'd like to recognize the planning committee and the development staff who helped to make this evening's event so successful. Committee members include Dr. Otha Miles, Dr. Charlotte Jones-Burton, and the Office of Development Special Events team. Thank you so very much for your hard work and your commitment over the years. Ladies and gentlemen, please enjoy the program. Thank you again for joining us this evening.
Thank you, Dr. Reese. I am humbled to be with you this evening and share my thoughts on the meaning of diversity. I cannot think of a time when diversity was not a part of who I am. From birth, my family instilled in me the pride that comes with being a diverse individual, celebrating the food, the customs, the values, and simply the togetherness that came with my Puerto Rican identity. It was so much of who we were as a family that although born in the United States, I always proudly stated, I am Puerto Rican. It is through this diversity lens that I view America and have experienced with others, the nation and the world. As one can readily acknowledge, diversity encompasses all of our identities and provides a level of excellence that cannot be achieved without it. My first influential mentor and role model was my grandmother, whose inclusive lens allowed us to value people as people. However, along with many of my Black and Brown peers, I experienced the exclusion that comes with being a diverse individual. Today, as part of my journey, I will share my story and encourage all of you to continue to do the same. Storytelling allows us to find the support, resilience, and grit to forge ahead. My journey is like many of the individuals who we want to support with this evening's event. I am a product of teenage parents who divorced when I was 10. I come from an educationally and economically disadvantaged background, and during my senior year of high school, lost my brother while awaiting a visit with a specialist who may help diagnose and treat him. We were in the back of the line waiting for 3 months due to the lack of insurance. I also grew up at a time when there was and still is a gender gap. As a youth, my earliest inspiration came with the call to action of the civil rights movement, which has served as my catalyst through every step of my journey. As a product of affirmative action, I seized and embraced every opportunity to show that I belonged, and was fortunate to meet individuals who motivated me to unleash my full potential. Among the many role models and mentors were Josie Torres, an upper-class woman at Douglas College, who reassured my mother that I would be safe in college, and Foster Burnett, Assistant Dean for Minority Affairs at New Jersey Medical School, who insisted that I should go to medical school and not settle for another health profession. Coming into NJMS as a student, in many ways, we were ahead of our time, since diversity was visible across the continuum that included faculty leadership, such as Dr. Carol M. Levy, chair of the Department of Medicine from 1975 to 1991, president of the Association of the Study of Liver Diseases, and an African American who had faced many of the challenges that came with exclusion. I also met Dr. Helen Rodriguez Trias, a visiting professor who was a pediatrician and the first Latina president of the American Public Health Association and a women's rights activist. As I look at my own career and instill in everyone their sense of duty and responsibility, I am reminded of several Nelson Mandela quotes. Vision without action is just a dream. Action without vision just passes the time. And vision with action can change the world. Another quote, there is no passion to be found playing small and settling for a life that is less than the one you're capable of living. For me, champions of diversity, such as those being honored tonight, shape the world. And reflecting on the rungs in my ladder, I could never have imagined myself in the roles I've undertaken without the support of others who paved the way and served as inspirational role models. As a clinician educator, my administrative portfolio evolved from director of the medical intensive care units, associate dean for special programs, senior associate dean for education, vice dean, to my current position as executive vice dean and professor of medicine with tenure. I have been fortunate to also have Dr. Robert L. Johnson, one of the few African American deans in the nation, as my boss. Paying it forward has become my daily mantra that keeps me inspired and fulfilled. I thank those who came before me, my like-minded colleagues joining me today, and those who will carry the torch to push the movement. Unquestionably, the University of Maryland School of Medicine has much to be proud of, and tonight we celebrate its legacy. Recognizing the benefits of diversity, I have focused on the intersection of inclusion, equity, and social justice. This has been accomplished through a pipeline that goes from 6th grade through medical school and faculty levels. Diversity and inclusion must go hand in hand. It must be interwoven into everything we do. Inclusion can only be achieved when we also cultivate health equity and social justice. Thus, for 15 years, I have worked with colleagues and allies to implement a robust curriculum across all 4 years, which prepares our graduates to understand their responsibility in the care of diverse populations. In doing so, I am joined by faculty, staff, administrators, and many others. Simply put, everyone counts, everyone makes a difference. It has been a life fulfilled. The rewards we seek are through the accomplishments of the many diverse individuals we touch by turning their dreams into a reality. Amongst my greatest achievements, I was the proud recipient of the 2019 AAMC Herbert W. Nickens Award, and ever so humbled to have contributed to the diversity that he so deeply championed. It takes a village to raise a family. As you can see, I have multiple families, my medical school family, but also my personal family, where I am joined by my husband, Dr. Bruce Green, a physician and a very proud African-American, and our 3 children and a grandchild. Together, we have faced the challenges that come along with being an African-American male in America. As partners, our interracial dialogue is an everyday experience and one that gives me the courage to do my part in creating a nation that allows everyone to reach their maximum potential. We would simply end our caste system if we all dedicated our efforts to ending injustices. In closing, COVID-19 shed a bright light on the inequities that Blacks, African Americans, and Hispanic Latinx communities face. For some, this reality was viewed with disbelief, and for others, it was a new awakening. We are living and working in unprecedented times in which America must face its challenges and seek to eradicate racial injustice and achieve the racial equity that America must have for all. As you continue on your developmental journey, keep in mind how you might incorporate diversity, inclusion, and equity initiatives into everything that you do. Once again, I congratulate tonight's honorees, Dean Reese, and the faculty and staff for their dedication and relentless persistence in doing the right thing for society, especially our underserved, underserved and vulnerable populations, even when faced with adversity. Let's celebrate this event and honor the legacy of Black History Month with the knowledge that historical injustice will become a thing of the past and not our future. It is now time to present the Dean's Faculty Award for Diversity and Inclusion. This year's award will be given to 2 dynamic faculty members at this time. I would like to introduce Dr. Jay Magaziner, Professor and Chair of the Department of Epidemiology and Public Health and Director of the Center for Research on Aging, to present the first award of the evening.
It's my pleasure to introduce and present this year's Dean's Faculty Award for Diversity and Inclusion to Diane Marie St. George. Dr. St. George has made outstanding contributions to advancing diversity and inclusion within the fields of public health and medicine for over 20 years and has been a passionate advocate for diversity, inclusion, and health equity throughout her entire professional career. An associate professor in the Department of Epidemiology and Public Health, Dr. St. George is the department's vice chair for academic programs and director of the department's Master of Public Health program. She is a researcher in the field of health disparities and has won multiple teaching awards. Dr. St. George works tirelessly to recruit minority students and faculty to the MPH program. She serves on the School of Medicine Diversity Advisory Committee, and this past year made major contributions to the School of Medicine Mini Med School through her leadership and mentoring of MPH students. She serves on the UMB Diversity Advisory Council that advises the president of the campus on issues of diversity, equity, and inclusion for the entire campus. She is chair of the Association of Schools of Programs of Public Health, Diversity and Inclusion Committee, and she serves on the African Women's Cancer Awareness Association Board of Directors. Her advocacy has included memberships on the Immigration Workshop Planning Committee of the Metropolitan Washington Public Health Association, the Maryland Department of Health and Mental Hygiene Cultural Competency and Health Literacy Work Group, and the Maryland Healthcare Commission Health Delivery and Planning in Rural Areas Work Group. Dr. St. George is a longstanding faculty member in the Department of Epidemiology and Public Health in the School of Medicine, and has been dedicated to promoting diversity and inclusion, which make her an ideal recipient for this award. Congratulations.
Good evening, Dean Reese, Honorary Gala Chair Dr. Soto Green, students, alumni, staff, faculty, benefactors, and friends of the University of Maryland School of Medicine. Please allow me to start by congratulating tonight's other awardees, Drs. Lobo and Griffinger. It is my privilege to share this virtual stage with you this evening. I am fortunate to have been on the faculty here at the School of Medicine for the past 12 years. So much has happened in that time. 12 years ago, I could never have dreamed that I would be here receiving this most generous accolade. But then again, so much has happened in the past 12 months. 12 months ago, I could never have dreamed that I would be attending the diversity gala in my bedroom slippers. Things have indeed changed. I feel optimistic about some of the changes that I've seen over the past 12 years. For example, there have been structural, organizational, and policy changes that tell our current students, staff, and faculty, as well as the prospective ones, that we are committing ourselves to the work of diversity, equity, and inclusion. With the addition of a School Diversity Advisory Council, Assistant Dean of Faculty Diversity and Inclusion, and Director of Student Diversity and Inclusion, we are committing ourselves to this work. In instituting a requirement for unconscious bias training for persons responsible for hiring faculty and admitting students, we are committing ourselves to this work. In commissioning a program in health equity and population health, we are committing ourselves to this work. When we volunteer our time to mentor underrepresented post-bac students in our school's STAR Prep program, we are committing ourselves to this work. When we offer our preferred pronouns so that others feel safe using theirs, we are committing ourselves to this work. When we install a tribute to female pioneers in the School of Medicine, we are committing ourselves to this work. And when we break down obstacles to admission and retention for first-generation students, we are committing ourselves to this work. So tonight, let us renew that commitment. Tonight, we celebrate our diversity because we are Asian, Black, Latinx, Native, and white. We are female, male, and non-binary. We are genetic counselors, life scientists, medical and research technologists, physical therapists, physicians, and public health professionals. We hail from many corners of the globe. We grew up in big cities and small towns and villages. Our families, houses of worship, and voter registration cards all look different. But while we celebrate tonight, we recognize that the work is certainly not done. The work will never be done, but we can tonight recommit ourselves to doggedly identifying and eliminating barriers to diversity, equity, and inclusion around us and in the communities in which we live and work. So in closing, Dean Reese, I'm truly humbled by this honor. Thank you. And to my department chair, faculty mentors, staff, and students, I owe you a debt of gratitude so large that I can never repay. Thank you all.
Congratulations to Dr. St. George, and thank you for all of your inspiring work and dedication. You serve as a wonderful example and mentor to students and faculty alike. Now I would like to invite Dr. Asaf Keller to present the second Dean's Faculty Award for Diversity and Inclusion. Dr. Keller is the interim chair of the Department of Anatomy and Neurobiology.
The University of Maryland School of Medicine and our Department of Anatomy and Neurobiology and the program in Neuroscience have long been committed to addressing issues of diversity. But our commitment has not always resulted in significant advances in our goal of increasing the representation and success of marginalized communities in our programs. Professor Mary Kay Lobo has been changing that. As a member and chair of faculty recruitment committees, she advocates strongly for LGBTQ individuals, for women, and for Black, Indigenous, and people of color candidates. She shows us, her colleagues, how our misconceptions and implicit biases may result in us passing over highly qualified, diverse candidates. Dr. Lobo works even harder to promote diverse trainees, graduate students and postdoctoral fellows, both in her own laboratory and in the graduate program in neuroscience, which she headed until recently. She reaches out to minority-serving institutes in our country, as well as to students in developing countries. Thanks to her efforts, the number of applications from underrepresented minorities increased by a staggering 300%. And the most recent class she recruited has more than 30% underrepresented minorities. It is not enough to recruit diverse individuals. It is equally important to create an environment in which they can succeed, especially because they may come from disadvantaged backgrounds. Dr. Lobo creates resources to support our recruits and provides personal mentoring to make sure they succeed. And she continually trains us, her colleagues, in ways to address our implicit biases and microaggressions and guides us towards becoming an anti-racist environment. Mary Kay, we're all deeply grateful for what you're doing. We're fortunate to have you here.
I'm very honored to receive the Dean's Faculty Award for Diversity and Inclusion. I would like to thank Dean Reese for this honor. I also thank Asaf Keller and Peg McCarthy for nominating me for this award. I've been very fortunate to host and mentor in my lab many trainees, including undergraduate, master's, and PhD students from diverse and underrepresented backgrounds that visit from minority-serving institutes in the US and from universities in Central and South America. I'm especially grateful for the members of my lab who deserve special recognition because they are the individuals that are providing enriched mentorship and training on a day-to-day basis to these visiting trainees. Additionally, the mentors and diversity program leaders at minority-serving institutes across the Americas deserve tremendous gratitude. These individuals often go unrecognized when they are the ones working the hardest to provide opportunities for underrepresented trainees, and they start these trainees early in the academic scientific research pipeline. I've also been involved in efforts in the program in neuroscience, also known as PIN, and my former role as Director of Graduate Education, and currently as the chair of the PIN Diversity Committee, where we work toward addressing and improving diversity and inclusion while combating bias in neuroscience. There are many individuals engaged in these goals to make active change, including PIN leadership, faculty, trainees, and staff. It's been very encouraging to see students and postdocs who have been especially eager to participate in these initiatives, engage in discussions, and provide creative solutions toward combating racism and bias in science and improving diversity and inclusion. This award is an inspiration as we engage in these efforts, and I'm incredibly grateful for the trainees, staff, and faculty in this inclusive neuroscience community and in the School of Medicine that are committed to real and positive change. Thank you for this honor.
Thank you, Dr. Lobo. Congratulations on this honor. Your commitment to increasing diversity, inclusion, and for serving our students is encouraging. At this time, I would like to invite Dr. Sandra Quesada to the stage to present the 4th Annual Dean's Alumni Awards for Diversity and Inclusion. Dr. Quesada is the Associate Dean for Admissions and Assistant Dean for Multicultural Affairs at the School of Medicine.
It is my distinct honor to present the recipient of the 2021 Dean's Alumni Award for Diversity and Inclusion to Dr. Robert Greifinger. Dr. Greifinger graduated from our School of Medicine in the class of 1971. And while I have not yet had the honor of meeting Dr. Greifinger in person, we are inextricably linked by our dedication to diversify medicine. Dr. Greifinger contacted me after a recent publication of the Medical Alumni Association's bulletin published an article where I shared our current strategies to achieve equity in medical school admissions and some of the positive early outcomes we've had, including an increased proportion of underrepresented students from around 12 to 13% for the past several years to 24% in the 2020 entering class. He explained to me that when he began medical school in 1967, 10 of the slots in his class were reserved for women, and 1 slot was reserved for a student of color. Like our current students, Dr. Greifinger studied medicine during a tumultuous time in our nation's history, with a powerful racial justice and civil rights movement at the forefront. Recognizing the need for change, in 1968, as a medical student, Dr. Greifinger was part of a small but mighty coalition of students who formed an ad hoc committee for increased minority representation at the University of Maryland School of Medicine. And through this committee's work, established a summer program in life sciences to provide additional academic support to students from disadvantaged backgrounds, with a goal of recruiting approximately 20 students a year, primarily from historically Black colleges and universities. I suspect Dr. Greifinger and his colleagues couldn't have imagined that this program would live on today, 50 years later, as our pre-matriculation summer program that still exists to provide meaningful academic support to all students who may benefit. In time, we've learned that we all need to continually re-examine and refocus our processes in order to make progress toward our goal of reaching a day when there no longer are underrepresented groups in medicine. Today, Dr. Greifinger is an adjunct professor of health and criminal justice and distinguished research fellow at the John Jay College of Criminal Justice in New York City. As a healthcare policy and quality management consultant, his work focuses on the design, management, and quality improvement in correctional healthcare systems. He has extensive experience in the development and management of complex community and institutional healthcare programs and strengths in the bridging of clinical and public policy interests. Recognizing pioneers like Dr. Greifinger, who risked retribution even as a medical student, but was undaunted and remained dedicated and driven by his values to promote diversity and inclusion, that is what inspires all of us today to continue moving forward, continue challenging the status quo, and not only expect but create change through action. Thank you, Dr. Greifinger, for leaving us your legacy at the School of Medicine and for all you continue to do to advocate for the most marginalized in our communities.
I thank you so much for this recognition. In 1967, our class size at the medical school was 100, of which 10 slots were reserved for women and 1, yes, 1, for a student of color. These were rigid proportions. At that time, the wards at the university hospital were segregated by race, and there was certainly no focus in the school on ethics or the social determinants of health. We students were tired of hearing that there were few minority candidates and that these applicants did not have the requisite background for the school. So several of us medical students enlisted the support of the basic science faculty. We designed a program to recruit and retain disadvantaged students, primarily from Morgan State College. We raised $20,000, enrolled students in a summer program taught mainly by medical students and supervised by faculty. We also got the school to agree to increase class size to accommodate a much more diverse student body. And as you might imagine, this was no easy task. Some of us were close to being tossed out of the school for our activism, but the time was ripe for a profound change, a change needed for the better. I am thrilled to read about the makeup of the current student body. What a contrast to my class. Looking back on my professional career, I am most proud of the part we played more than 50 years ago in nudging the School of Medicine toward greater diversity, a trajectory that continues to blossom to this day.
Thank you, Dr. Griefinger. At this time, I would like to invite Dean Emeritus Donald E. Wilson to the stage. Among his many distinctions, Dr. Wilson was the first African-American dean of a non-minority medical school, and his tenure was the second longest of any medical school dean. His leadership in promoting diversity in medical practice has been superlative.
Thank you, Dr. Soto Green, for the introduction. Here we are at another virtual meeting. I would prefer to be with you in person, but I must admit that my house serves a better brand of scotch than the hotel. If someone had told me 14 months ago that we would be in the middle of a global pandemic affecting millions of people, I would have suggested that they seek professional help. COVID-19 has made even more apparent the healthcare disparities that have existed in our nation for generations. Those groups that are underrepresented in healthcare and biomedical research simply do not enjoy the same level of health as those who are not. Yet there is little question that increased professional diversity is a critical step that will help ensure high-quality healthcare for everyone in our nation. The University of Maryland School of Medicine is a gold medalist in proving this concept. Medically underrepresented minorities are approximately 30% of our nation's population, but less than 10% of our physicians, nurses, dentists, psychologists, and other healthcare professionals and scientists. The situation in the United States today is not too dissimilar to the stresses facing two cities described by Dickens over 160 years ago. Political turmoil and public division are rampant. At the same time, many are beginning to understand the reality of institutional or structural racism and are seeking ways to erase it. The realization that diversification leads to more success is increasing. Today, it is not unusual for medical students to graduate with debts of over $200,000 and double-digit loan repayment interest rates. We must find ways to support deserving underrepresented students, or we will never achieve the cultural, ethnic, and racial diversity that is needed to provide the best health care for our nation. So I thank Drs. Charlotte Jones-Burton and Northa Miles for their vision, persistence, and support of this scholarship. I thank Larry Petroff and the Medical Alumni Association for their steadfast support. I thank Dean Reese for making this a priority annual event. I especially thank my wife, Patricia, for supporting our annual contributions. And of course, I thank all of you for participating and for contributing. Contribute more. Doctors Greg Carey, Rob Phillips, and Sania Amer served as the Wilson Endowed Scholarship Review Committee. Thank you for your time and rigorous review in selecting the list of finalists. I would now like to introduce two medical students who will share remarks regarding their medical school experience and the opacity of diversity scholarships. The first is Cameron Burt, who is a second-year student. He will be followed by Kayla Kichwa, who is a first-year student and the current Wilson Endowed Scholarship recipient. Thank you. Students, the stage is yours.
Good evening. My name is Cameron Burt, and I'm a second-year medical student here at the University of Maryland School of Medicine. This past year has presented our society with so many challenges. Some of them new, but some of them also all too familiar. When COVID-19 first gripped our country, many medical scholars predicted that communities of color would fare the worst. And as expected, this was unfortunately what played out. Now, more than ever, we need to continue our investment in diversity and inclusion in medical education to train physicians and scientists prepared to tackle the challenges of our diverse population. In reflecting on my own journey into medicine, I remember the moment in middle school when I first realized it was possible for me to become a doctor. Before then, the thought had never even crossed my mind, until one day I opened up a magazine and saw a Black man in his long white coat sharing his own journey into medicine. Becoming a doctor became my dream, and I feel honored to be able to realize that dream here at the University of Maryland School of Medicine. As a child, I came to the area around campus from time to time, particularly to go to Lexington Market to get food with my family, and especially the raw oysters at Fadley's that my dad enjoys. In the first couple of months of medical school, I returned to Lexington Market. As I walked through the building, smelling food being cooked by different vendors and seeing groups of people catching up with friends, I felt right at home. But this time, not as a patron, but as a future physician, encouraging members of the community to attend SNMA's annual health fair. After receiving a nutritious lunch and important health information, many people thanked me for telling them about the event. And it felt like such a full circle moment, returning to a place I had been so many times before. I look forward to continuing to advocate for the health of people who often feel forgotten by the medical system, and collaborating with my colleagues so they feel comfortable doing the same. I'm grateful for the investment into my education, which has allowed me to develop my medical knowledge, engage in novel research, and volunteer with programs such as the Cure Scholars, so that maybe one of those students will look at me and have the same realization that I did some years ago. In order for our medical school to be at the forefront of medical education, research, and clinical care, we must continue educating and training a diverse group of people. When this is a priority, we are all opened up to new ideas and experiences, which translates to better outcomes for our patients. If we continue these efforts, the story of the next major disease will not be how it has impacted different portions of our population, but rather how a diverse medical community used their unique backgrounds and worked collaboratively to stop it from ever taking hold. Thank you.
Good evening, and thank you for inviting me here to speak. This time last year, I was overwhelmed with the decision of choosing a medical school to attend. When it came down to making my final decision, I wanted to choose a school that valued diversity by showing me that there was a sense of community for Black students and by showing me that they valued serving underserved communities. When I attended the Celebrating Diversity dinner last year, it was clear to me that University of Maryland School of Medicine was the perfect fit. Between the informative presentations and the students and faculty that I met last year, I could immediately sense the community that I was looking for and saw their dedication to serving the Baltimore community. Being honored with the Donald E. Wilson Scholarship for wanting to practice medicine with underserved communities has motivated me throughout my first year of medical school. As a recipient of this scholarship, it is a constant reminder that I want my medical career to be about advancing and serving communities that are oftentimes neglected. Although starting medical school amidst this pandemic has been difficult and isolating at times, Maryland has given me many opportunities to still be involved with the school and my peers, as well as staying involved with the outside community. I really want to commend this year's e-board of SNMA, the Student National Medical Association, because the MS2s on the board have gone out of their way to ensure that Black and other underrepresented minority students in my class had the chance to build relationships with each other and with faculty. Diversity programs such as SNMA are so valuable, especially during times like this when having a sense of belonging is more important than ever. Diversity programs remind students like me that we are not alone on this journey and that there is a whole community of people who want us to succeed. I was recently elected as a co-vice president for SNMA for the 2021 to 2022 academic year, and I'm really looking forward to continuing the work the current board has been doing. I'm also doing the Combined Accelerated Program in Psychiatry elective, also known as CAP. CAP has been one of the highlights of my first year because I've been able to virtually meet and talk to patients every week while learning about psychiatry and the patient population in Baltimore. I'm also a member of the School of Medicine's Second Look Day Committee, where I can aid in the recruitment of new members of the School of Medicine. Additionally, I've been a volunteer for the THREAD program. For those of you who don't know, THREAD is a program dedicating to helping youth in the city of Baltimore who are facing challenges academically. It's been truly rewarding experience to get involved with the Baltimore community and getting to work directly with a young person and making an impact in their life. Thank you for taking the time to listen to me, and thank you, Marilyn, for providing me with these opportunities.
Congratulations to you all, and thank you for your commitment, enthusiasm, and all your inspiring work. Please know that you are joined by many, and together we will end racial injustice and achieve equity for all. Let our work continue, inspired by those whom we honor today. Our call to action has never been greater. This concludes our program and the 14th annual Celebrating Diversity reception and dinner. Thank you for joining us for this wonderful evening, and thank you for your continuous support of the School of Medicine.